Hi, good morning. I'm Gail Lee. We're back again. I think, is this our two, three, four, fifth session or fifth or sixth? I'll get it straight. But anyways, we're doing these presentations in series in conjunction with Eamon Ganner and Capriano, your Estate Matters LLC. Um, it's important to, when we're looking at the different planning and preparation, that we're looking at all the different aspects. Again, Aging Advantage, we're a nonprofit here in the St. Louis area, and we've been around for a long time, since 2017, and our primary goal is to help those individuals 60 and over and 18 years old and older with disabilities, and their families, helping them to manage all aspects of their daily life. And we're pretty dedicated to serving the whole greater St. Louis area. We do a lot of things with care management, mental health supports, home delivered meal assessments, care coordination, which is benefit planning, which is real important right now. And a big portion, we do a lot of these virtual and in-person classes. Today's training is partially funded through the nonprofit agency, but partially funded with donations and support from the city of St. Louis ARPA funds. And those funds were provided through the city to help households that have experienced a negative public health impact, economic impacts from COVID-19 and in different areas, and also like social isolation coming out of that, and all the different things that were impacting those households. And so we've teamed up right now with Eamon Gantner Capriano to bring you these topics. Again, I'm the president of the board for Aging Advantage, but I also an employee here at the law firm with Amanda Wilson here, who is our attorney that's kind of over, with our elder law team. So we have a team. I'm going to let her kind of explain the law firm's role.
Absolutely. Okay, well, you might have caught previous segments of our little series we've got going on here, maybe not. But what Gail and I are trying to bring to you is sort of this whole compendium that is a roadmap to planning, protection, and peace of mind. So we're kind of going through the aging process and what planning for aging looks like, how long-term care considerations fit in from both a care management perspective, and from obviously a legal perspective. So legal documents you need to have, how we go about planning for benefits, that kind of a thing. And today we're actually going to talk about dementia and other sort of special considerations. So other particularly debilitating illnesses that really have a big impact in sort of this long-term care planning area. So what we really want to look at today is how does the care landscape and long-term care plan change when one is dealing with dementia or other unique health considerations. So we just kind of want to bring attention to sort of these niche areas that are impacting our community more and more as we see dementia is becoming more and more common. And because people are living longer, we tend to see more of these chronic illnesses that sort of require a more distinctive care plan and a more distinct plan from the financial side as well. So like Gail said, both Gail and I work for Eamon Ganner and Capriano. We do estate planning and elder law. We also do postmortem work. So that's going to be probate and trust administration. We're all members of the National Academy of Elder Law Attorneys and the American Academy of Estate Planning Attorneys, and we're accredited by the VA to handle veterans claims. So in the picture there is Jackie, Charlie, and Paul. So they are Eamon Ganner and Capriano. And this is me. I'm an attorney licensed in Missouri. I got a BA in English and Economics from the University of Mississippi, and I got my JD from Wake Forest University in Winston-Salem, North Carolina. I am from St. Louis, born and raised, went to Prairie Zoo for high school. That sort of took a little detour through the South for my education, and then came back here. So Like I mentioned before, I'm a member of the National Academy of Elder Law Attorneys and the American Academy of Estate Planning Attorneys, and I am accredited by the VA to handle veterans claims. So this is our elder law team at Amon Ganner and Cabriano. So it's myself and Gail, as well as Maggie Burgess. She's another licensed clinical social worker. Um, and really, I like to put this slide up, if nothing else, to show how much the legal goes with the care management side of things, right? We work hand in hand sort of throughout this process, and it's because all of these decisions we're making sort of can't be separated. And it works really well for us. So, all right, today.
I was
Oh,
just
go for it.
thinking a few minutes ago, like, um, I know that you're going to talk a lot today too. And like before we did the legal, and I kind of chimed in, and the other day we were doing some things that were more care management, but you got a lot to say. And so, when you look at your education things, you're going to school to be an attorney, or you're doing that now that you've been here at the firm as an intern a few years and now over a year, and you're solely really looking at our elder law things. It's probably pretty amazing to you how much you know about all this other stuff.
Oh yeah, no, I've learned so much, and I think it makes me a much better attorney, honestly. It makes
Hmm.
me much
Hmm.
better at my job when I can have a real conversation about that other side that, I didn't learn any of that at any point in school.
Yeah.
Um, but
But
yeah, it's a great
but
setup.
you're seeing it all the time with the families, and really having educated yourself, and us too, like working together, all of us, all three of us, to bring all these aspects together.
Yeah, and it's the way we can best help the clients, really and truly, is sort of the holistic approach, which is what we're encouraging through this series too, is a holistic approach to planning for individuals and looking at what do I want these years to look like for me or for my loved one, um, and what are their priorities. All right. Well, today we're going to start with dementia. And that's only because, for the most part, it is most widely seen, um, and really does have a lot of implications sort of in this planning arena. Dementia is a group of conditions that impact memory, reasoning, and communication. So, a lot of times, I think people just say Alzheimer's when what they mean is dementia. Um, and dementia really affects many, many more seniors than sort of, I think, popular culture would like to um, present or admit. But here are, oh, timing is everything with dementia. So early diagnosis allows meaningful participation in planning. The sooner that an individual is aware that they have dementia, the sooner they're able to not only take part in their own planning, but sort of have that reflective time of, okay, how do I want this to go? Who do I want to care for me? Um, do I want to stay at home? Do I need to be thinking about going to a facility? Um, and just the more you can prepare, the more you're set up to avoid the crisis decisions and the, okay, something's got to happen now. Um, and we see that all too often when clients come in here and maybe there was a dementia diagnosis 5 years ago, but then they come in here and they say, okay, mom was diagnosed 5 years ago. Now she's getting really bad. She needs to go to a facility. What can we do? And the hard truth is your options are significantly more limited today than they would have been 5 years ago. And more than likely, mom is at a place today where she can't really actively participate in what's going to happen.
Yeah, and I think, people get scared by that diagnosis, and there's,
Yeah.
and people, there's so many different types of dementia, and we're going to talk, in a few seconds about some of the main types, but there's very, very many different types, and they're affecting us in different ways. But like you said, people focus maybe just on the Alzheimer's are not realizing it's more of an umbrella. The dementia is an umbrella over these other diagnoses. But a lot of the warning signs, for Alzheimer's in particular, are just the memory loss that starts to disrupt our daily life. We all have times when we can't remember something, or you get that word on the tip of your tongue, or you kind of misplace something. A lot of that's mindfulness, but at some point it starts to be not that. We have, those different challenges when we're planning and problem solving, or just difficulty doing familiar tasks, and kind of that confusion, trouble understanding. So it just really progresses. So at some point when people get that diagnosis, it's almost like they're trying to hide it and be ashamed or something, instead of, going ahead and planning and putting protections per se in place so as it progresses.
It's important for family members to watch out for it too, and maybe have that real conversation of, maybe it's time for you to go see a doctor. I've been noticing you're a little more forgetful than normal, or you can't seem to. My dad actually went to the doctor a couple months ago because he used to know. I mean, he could name an actor and what this actor was in from like the 60s, 70s, just any movie you could think of. And he doesn't have that sort of like a very impressive recall anymore. And it was concerning my mom. And so she had been bugging him forever. You need to go to the doctor. You need to mention it to your doctor. Doctor said he was fine, but it's just one of those things where sometimes I think family members are honestly in a better position to notice, right? When their loved one is, oh, you're not remembering things quite like you used to. Or maybe you're confusing things more than you used to. And there's less of a bias there of, if it's yourself forgetting, I think you're a lot more likely to come up with excuses, right? Oh, I'm just not paying attention, or I'm
Mhm.
tired, or this, that, or the other. And it's so gradual that I think it's
Right.
hard for you to really notice the decline in yourself, but I think it is something that your family members notice.
Yeah.
And that's a horrible, hard conversation to have, but it's super important.
Very, very true. And doctors, not all doctors, are created equal on the topic. And so sometimes if it gets real concerning, going to a geriatric doctor or the memory clinics, where they have, more training in picking out those
Sure.
very specific things.
Yeah. So these are the four most common types of dementia. Um, and we kind of just wanted to go over these because they're the most likely to be seen. So we've got Alzheimer's, vascular dementia, Lewy body dementia, and frontotemporal dementia. Alzheimer's is 60%, 60 to 70% of cases. So it's definitely the most common type of dementia, and probably what most of us think of when you say dementia, or, memory issues, that kind of thing. You think of the symptoms of dementia, you think of the primary care needs for Alzheimer's. But we kind of want to draw out these different types of dementia because they do all have different sort of focuses in the care management realm and different signs. Um, so Alzheimer's starts with memory loss, confusion, difficulty learning new information. It'll gradually affect language, judgment, and ability to perform daily tasks. Um, and changes tend to be slow, but they're progressive. Um, And then effects on care for Alzheimer's, consistency and familiarity are super important. Um, and when we think about Alzheimer's in the long-term care realm, a lot of times we will have clients who have Alzheimer's who then need to go to a facility. And that's a really, really hard transition, especially as we get more progressed in the disease. because it's very discombobulating for the person. They don't know where they are, and structure is so helpful to people with Alzheimer's that when you change their entire structure, they become much more disoriented, and they sort of, you see this like rapid little decline there when they're initially placed,
I think you
and
see
then
that
slowly
too.
they adjust, but
Yeah.
sorry.
I think you see it too. All of a sudden, people will be okay at a certain level, and then all of a sudden they're hospitalized for maybe a totally different reason, a UTI, something, and they're having to go to rehab or something else, and then all of a sudden that it's just such a more rapid decline all of a sudden, and the family are like, wait, but it's so sudden, what just happened? But
Right.
changing those environments, it can be an issue. And so sometimes looking at going to a facility or assisted living or independent living type thing where it's a continuum of care and maybe more um, more familiar so that they're learning that what's happening a little bit earlier is able to for them to help put that into their routine.
Right, absolutely. Wandering is pretty prevalent among all people with Alzheimer's. Um, so hands-on care and supervision are really necessary, which can take a huge toll on families or on whoever is providing that care. And so sometimes um, a facility environment somewhere with a continuum of care, it's a good option for individuals or for a couple when one spouse would have Alzheimer's, that kind of a thing. Um, Vascular dementia is caused by a reduced blood flow to the brain. So a lot of times vascular dementia comes on after a stroke or a series of small strokes. Um, and symptoms can appear suddenly or they can appear sort of progressively. So in like a stepwise, right? Um, and mostly there are physical symptoms with vascular dementia, slowed thinking, poor attention, weakness, and balance issues. There's a huge risk for falls in individuals with vascular dementia. So mobility support is extremely important. Um, and progress may plateau, then suddenly worsen. So caregivers really need to plan for sort of that unpredictable change in outlook, which is difficult. Um, so that's sort of vascular dementia. Then you have Lewy body dementia. Um, and Lewy body dementia is caused by abnormal protein deposits in the brain. So this is the one that a lot of times they say, oh, you've gotten a scan, you can tell that it's Lewy body dementia. Um, and by the way, you can have multiple types of dementia going on at the same time. So just keep that in mind too. I'm sort of going through these in their own silos, but you can have, Alzheimer's with Lewy body dementia, for example. Um,
It is pretty with Lewy bodies. At some point, it's very rapid. Like, it might those proteins are building up. They might not be quite as evident or what have you, but at some point, it's very, very rapid and causing a lot of disturbance. And I've seen, the morbidity and people die quite quickly at a certain point where Alzheimer's is that slow progression.
right, right. Early signs for Lewy body are visual hallucinations, sleep disturbances, um, movement problems. There's fluctuating alertness, um, and some movement problems. So almost more like a Parkinson's type symptom, stiffness, tremors, things like that. Um, as far as care goes with Lewy body dementia, medication sensitivity is a big consideration. So many antipsychotic or sedative drugs can worsen symptoms or be dangerous. So you really need to be careful there. Supervised mobility is very important. Again, routine is important for individuals with Lewy body dementia. And calm environments help. They reduce hallucinations and confusions for folks with Lewy body dementia, um, which is also something to keep in mind in the facility context. You know, if you're looking at facilities or thinking, you know, maybe we'll go to a facility, a calm environment is always preferred. Our last type of dementia that we wanted to talk about is frontotemporal dementia. That's caused by nerve cell damage in the frontal and temporal lobes of the brain. It all often begins earlier than a lot of these different dementias. So many people have heard of early onset Alzheimer's. Frontotemporal dementia usually begins between 45 and 65. Um, and it's really marked by personality and behavioral changes in an individual before any sort of memory problems appear, which makes it a little trickier, I think, to spot than a lot of the different sorts of dementia. Um, Individuals can lose empathy, they might act impulsively, or have difficulty speaking or understanding words. And we'll talk about some of those symptoms later, actually, in regards to some of the other special health considerations we talk about. But just key signs to keep in mind there. And then as far as primary care focus goes, behavioral management is super important. Safety is super important. And there's a big emotional impact on families because loved ones may feel like their loved one has changed. You know, they're not the same person they were before. And that's a very hard thing to deal with when you think, you know, my mom isn't my mom anymore. She's not the same person. Um, and you sort of see those same challenges with diseases like Alzheimer's, where you think that they don't recognize me anymore. They don't even know who I am anymore. But it's a little different when they stay the same but don't know you, or when they're changing. Um, so just
I
sort
think
of the
that's an
different.
important, you mentioned a few minutes ago about, caregivers. And when you look at just the caregiver stress overall among all these different types, they're all kind of reacting different but you're there for the long haul and it just brings you down. We'll talk more about it, but you were kind of getting that, where it's either explaining or listening to them over and over on the same topic or what have you. So there's different frustrations and then when we were just talking about Lewy bodies, just there on the slide, it's talking about supervised mobility. A lot of that, there's a lot of mobility issues and a lot of fall risks and just being there for through all these processes is very, very stressful.
Right. Absolutely. Um, so those are kind of four big categories of dementia that we sort of wanted to bring attention to. Now, how does dementia impact planning and sort of impact everything that we've been talking about in the rest of our series? It really makes planning even more important. And that's because an individual's decision-making ability, their capacity, will change over time. And so the earlier we can get legal documents in place, we can get these plans in place, the better off we are to sort of move forward with that plan. And really, the sooner the better, because once we reach a place of capacity may or may not be there, it's much more difficult to get legal documents in place. Without those, we would be looking at conservatorships and guardianships, which are impossible and time consuming and expensive and court supervised and all the things you don't necessarily want for your loved one or yourself. Um, but not only that, we need to think about recording care preferences and reviewing plans, you know, with your loved one, or if you are the person, you need to be thinking really critically about, what do I want this to look like? And the more you're able to think about that, the better you can set up your loved ones. So whether it's your kids or your husband, because you can take some of that guilt away from them, you can take away some of the stress that goes along with taking care of you, maybe, because you've made your wishes clear. So there's peace of mind in that, really.
And I think in the earlier session, we talked about procrastination being a big issue with this, but also with just what we were talking about, the kind of the uncomfortableness and the denial of, oh, my loved one has this issue, and we don't want to, we're just uncomfortable bringing it up. And but really we're giving them the best grace or the best dignity to kind of listen because they're scared as well, so acknowledging that and getting these things in place is super important, I think.
That's right. And Gail, I'll let you kind of talk about sort of how dementia looks from.
Yeah, it just does really, again, it's progressive, it changes over time. So kind of looking at that and, um, the biggest burnout is a really big problem. So considering different respite care, people that can step in to help you, those different support system, um, looking at different support groups in the area. We will be talking about resources next week. So just looking at those resources and how the family can collaborate together and share different roles so that just one person isn't doing everything. And a lot of times, and we talked about that, I think the other another class too, that sometimes that collaboration is hard. It tends to a lot of times maybe fall on one sibling, or people aren't totally agreeing with what's going on. So sometimes you need a care manager or somebody in there that's helping to pivot and put that together, or having kind of holding family meetings to help negotiate that, because we tend to maybe go back to some of our rivalries from when we were growing up or something. So just really listening to our parents and what are that loved one and what's happening. And also it's not necessarily just the siblings, people have friends, they have support within their church, they have different groups that they belong to, and other people are willing to step in. But again, sometimes that keeping it so closed in into the family, that embarrassment of what's happening. I remember a case here many years ago, and the people came and they seemed just a few months prior, they had brought some information and it was pretty accurate and not too many issues with it. And all of a sudden, a few months later, they came back. One of my coworkers that I hear now, they went in and they couldn't figure something out. They came and got me, and I was looking at the bank statements and different things, and I was like, wait, what's happening here? And I was trying to put that together and it just trying to figure it out because it just didn't make any sense. And all of a sudden, I even just closed the door because the door happened to be open, and I was just like, what's happening here? I'm real confused. And then they finally said, well, this early onset dementia thing's happening, and we're trying not to tell anybody, and almost like it was a accusatory thing. And I was like, oh, okay, well, what are we going to do about that? Because you have to get something in place. They were just really scared. The spouse was very scared. And it was very rapid all of a sudden, because it was also an early onset. But the person knew what they were still capable of, but they were very scared, because they had watched their parents have the same situation. And so we were able to help put that together. Um, I just think it's so important when you bring all that together in there. Just again, the communication and the compassion. Um, but it does, you do need that support. I don't know, what have you noticed, Amanda, that you think of?
I think it's just open communication is, I would say, possibly the most important thing, um, among family members as much as possible, between spouses. It's really important. Um, and just the thought of, you know, that care landscape and what it looks like can change. So we had a couple clients a couple months ago. They were spouses, and the wife had dementia. And she had said she wanted to stay at home no matter what. Um, and then she stopped recognizing her husband. And so, she would see him in the house and kept calling the police, or she would physically assault him. Um, and it was horrible for him and really caused a very rapid decline in his own health. Um, but also, it wasn't any good for her either. It was terrifying her. Um, so, and I say all that for the suggestion that, okay, maybe being at home at the beginning was the best thing for her, but that can change sort of as care needs change. Um, and at the point where these clients came and saw us, it was time for her to go somewhere um, where a higher level of care could be provided to her, and not only for her own safety, but for his safety, um, and for his health, which, as I mentioned, was sort of rapidly declining as well. And I think family members have a tendency to put everything on themselves, and and they need to know their limits with that as well, and have a realistic conversation of, maybe it's, I will keep you at home as long as I possibly can. um and it's sort of a theme we're seeing throughout the illnesses that we'll talk about today is um they all tend to last a relatively long amount of time. And so then in the long-term care planning perspective, you do need to think more seriously about, okay, finances are going to play a big role here. How much money do we have to spend to stay at home? How much money can we pay for a facility? What does this need to look like? Is it, if it's a spouse, how long can I keep you at home? How long can I pay? Because I have to consider keeping myself at home and keeping myself, keeping the electricity on and food on the table and all of that as well. Um, but it's also just the emotional toll and the physical toll that these illnesses take, not only on the individual, but on their loved ones. Um, and so it makes the planning, you're planning for a longer amount of time.
I think with that, I mean, it's like the plan can't be so concrete,
Right.
like you're saying, okay, I was going to keep you at home. But then all of a sudden, thinking that the person's an intruder and calling the police and being that worked up about situations not healthy. And so, but again, and so I think in that case too, maybe the person's thinking, oh, I have to keep doing this and I have to keep doing this and trying to do it themselves and not reaching out um, to their kids and telling them how bad it's getting. So just being aware and having, I think when you do have those family meetings, a lot of times you, if that's a regular check-in, you can start to look at, well, what is happening differently. A lot of times we just get so into trying to do everything that we're possibly doing that we're not really seeing that bigger picture and what's changing either. We're just trying to,
Yeah.
oh my gosh, I just got attacked. We're just so into the middle of that we're not realizing.
And having that outsider perspective can help so much too,
Mhm.
whether it's the doctors at the hospital or whether it's, clients who come to us, and we're able to say, it's time, you can't keep doing this. And sometimes that is the sort of the push and the support that people need to say, okay, this needs to change now. Our plan had worked, but the landscape has changed. And so how are we moving forward now?
And I
And so,
think so many people take it as a failure. It's not really a
yeah,
failure. Yeah.
and not at all. No, I mean, and I don't think people think that they've done everything they can do. They think, but short of, there has to be a limit. But okay, so that's sort of dementia. Now we also wanted to talk about other special health considerations. So other sort of debilitative chronic illnesses that we see at the law firm, and that sort of lend well to this conversation of long-term care and planning ahead, those sort of things. So Parkinson's disease, it's a progressive neurological disorder, primarily affects movement. Early symptoms include tremors, stiffness, slowed movement, shuffling gait, a lot of times balance issues. And as it advances, speech, swallowing, and fine motor skills can be effective. There might be mild cognitive decline there as well. Depression and anxiety are also very common, go along with Parkinson's disease. So also keep in mind here, we talk about a lot of these physical problems, that these diseases take a huge emotional, mental toll as well. So things to consider there as well. Progression wise for Parkinson's, it's usually a gradual progression, motor symptoms first. And then the effect on care, medication timing is critical. So super important that medications are coming, at the exact same time. No doses are missing, they're not delayed. That can really worsen the mobility problems of the individual. Fall prevention and home safety is super important. So maybe you're looking at modifying the home to make it easier for the individual. And as always, fall prevention is so important. And then regular physical and occupational therapy can really help maintain function and independence for as long as possible. So that's a great thing to consider here. Huntington disease is an inherited disorder. It causes involuntary movements, and mood and behavioral changes as well. It's a genetic condition, so it's actually passed genetically. Um, and because it's inherited, family members may face their own genetic risk. So just something to consider if that's a diagnosis, think about. And there's early testing and screening. So, if you end up having a Huntington's diagnosis, maybe you consider testing your children or your siblings, so that everybody knows what's going on. But Huntington's is sort of categorized with a steady decline over a 10 to 20-year period. And symptoms usually begin somewhere in midlife. So we had a client recently whose wife has Huntington's, and she was only 34. They had two little boys. I have two little boys. But so definitely can come on very early, can come on later, just depends. But normally, symptoms arise somewhere around midlife. Effects on care for those with Huntington's focus on safety and supervision. A lot of times there's impulsive behaviors and movement problems. The client I was just talking about, she was at the point where she was so completely independent, could walk by herself. She was very stiff. But as far as feeding herself, her husband had said, like, basically she can probably manage to make herself a peanut butter sandwich, but she won't necessarily think to feed herself. And who knows what the kitchen will look like after she would do that. So,
And I think the biggest thing with this too, well, besides all the horrific health things that are happening, is just what you were saying about the testing. There's a widespread, in terms of the idea, in terms of even having kids tested or what have you. If you have it, you're going to get it at some point in your life, and that particular gene. And so some people don't really want to know, because then they know, well, I'm going to have this. This is going to happen to me. And some people do want to know. And so kind of putting it on your kids before they can make the decision, it just makes a lot of different outlook in your life. So going and having the um, different counseling, way specific for that issue and how it would impact you, knowing or not knowing, is an important key thing to think about.
Right. Yeah, I personally could, I'd have to know. But I do know, I mean, I know many people who choose not to, and that's,
Because
okay too.
I think they're thinking it's like, well, what is the difference if I'm going to have it or I'm not going to have it, and so how's it going to impact my life, which way? So yeah.
It's definitely a consideration. Um, as far as care for Huntington's goes, uh, focus on safety and supervision, behavioral management. So consistent routines often help reduce agitation for those with Huntington's. Genetic counseling is an option. Um, and as communication declines, use simple cues and calm reassurance. So that's Huntington's. Then there's multiple sclerosis. It's an autoimmune disease where the immune system damages nerve coverings in the brain and spinal cord. Symptoms can include numbness, weakness, vision problems, fatigue, loss of coordination. So we're seeing those balance problems again. Um, and sort of progression is pretty unpredictable. So some people have relapses and periods of recovery. Others will experience sort of a steady progression of the illness over time. Um, hard to sort of plan for when you're not sure, um, but also those patterns can be seen relatively quickly, and you can sort of accommodate your plan from there. Um, there's a little typo on my table there. I apologize. But effect on care wise, adaptive equipment like mobility aids will help those with MS maintain their independence. There's often temperature sensitivity, which can worsen symptoms. Uh, so keeping a relatively cool and stable environment is important. Emotional health support is essential. Depression is very common among those with MS. Um, and encouraged continued activity will preserve confidence for the individual and strength. So the stronger you can keep those muscles, you can keep that body, the better off you'll be. ALS, most people have heard of. It's a rapidly progressive disease that affects motor neurons. People retain full awareness, but gradually lose the ability to speak, move, eat, and breathe. Average life expectancy is 2 to 5 years after diagnosis, though some can live much longer. We had a man in my church actually who was close family friends with us. He had ALS. He survived about 3 years. But initially, his wife actually thought he had been drinking and he had a drinking problem because it would be 10 or 11 in the morning and his speech was slurred. And speech is not usually the first thing that people notice with the ALS. A lot of times it'll be, some sort of balance problem, something like that. But just something to keep in mind, there is that speech and swallowing difficulty there. And so he had gone to the doctor. He was in his late 40s at the time, but that was how they were able to diagnose. Progression pattern, like I mentioned, it's pretty rapid. And then effective care, mobility, and respiratory support are really important. Communication aids are very important because you do lose that ability to speak relatively quickly. Palliative care is something to consider, and just, what is care going to look like? Because the reality is you will need very, very intensive care relatively quickly. The last sort of special health consideration we wanted to talk about, and we'll sort of get into a lot more of this in our next theories, which is hospice and end of life. But cancer and terminal illness, Cancer, oftentimes fatigue, pain, weight loss, emotional distress, and progression pattern can vary significantly. And, obviously many people experience remission. Sometimes though, individuals will have the diagnosis that the cancer is terminal. And oftentimes are then given, some period of time. So how does that affect care? Pain management is very important, palliative and hospice care, and emotional and spiritual support there.
I think people probably wonder maybe, well, why are we bringing these up or in the comparison to dementia too, is just also in all these primary care focus areas and the ones that were for dementia, they're all slightly different. And so it's pretty important to be looking at them and how you can adjust because we were saying about how you can be so overwhelmed as a caregiver. Well, the support systems you need is different and what have you. And one thing that we didn't even really talk about, we won't really go into too much, but we have, there's a lot of people with pretty significant disabilities, just in general. And maybe they're paralyzed in some way, or just a lot of different things can impact. But we were just bringing up, some of the main ones, and just being aware this the cancer, lots of the treatments that you're getting for the different types of cancer, you know, really bring on a lot of, widespread um, kind of the memory issues too, or weaknesses, or just confusion. And so they're, kind of all over the gamut with that. And it's just, it brings in a lot of considerations. But, when you were talking about planning earlier, just experienced, just recently, one of the first times I've seen it where the person was so together with it. They had worked in a lot of different situations, I think, and knew that it, and even worked through with their spouse and different things. They called and had several very long conversations with me and got their plan so totally in order. They were just like, okay, I'm going to go to the nursing home now. I know I'm going to die within this time frame, so I'm going to get this together, and I'm doing, and they knew it was going to be kind of rapid-ish, and so they had it all lined out. And it was very, helpful and very impressive for them to do that. But they just had that clarity, knowing that that was going to happen. And so there was no need to keep postponing it. And, as I think about it right now too, it's kind of what we were all that we've talked about several times. None of us is getting out alive. I think we've said that. And so why we procrastinate on some of these things now, whether it's, today, tomorrow, way in the future, it does not hurt to be prepared.
No, the only person you're gonna hurt is yourself or your loved ones by sort of avoiding those tough conversations and those tough, moments of reflection. And I know for the client Gail was just talking about, they didn't want to be a burden on their family. And so they actually said, I'm ready to go somewhere. Um, and so that's why it's so important to think about, you know, what you want and how you want to handle your own health and your own care, um, and sort of have that autonomy. Gail, did you want to hit this a little bit?
Sure. I Yeah, I think it's kind of, it really goes into what we were just talking about, really, with the
Mhm.
emotional, you know, all the different illnesses bring on these different challenges and bring on just different emotional stress, different feelings about it when we first hear about it, if it's ourselves, like, oh, what is this going to mean? And what is it going to mean for my my loved one who's experiencing this. I know when you were just speaking of ALS, I thought back to my aunt of some probably, well, it's getting there of quite a few years now, 13, 14 years ago, but it was very sudden. I had visited her, used to see her like around Thanksgiving time, and she would go to Florida, and she was like having some problems with her foot, like drop foot, and she was like, "I'm going to the doctor there." When I get to Florida. So she did. And then all of a sudden she was back in Michigan where I went to visit. And I was like, oh, what? And so they had found out just in that period of time from Thanksgiving till then that she had ALS. And um, so I was able to talk to her on the phone. I didn't know she was originally there, so I didn't have enough time to go visit. And but then I went back home, I think in like July or August. It was pretty quickly. And so I called and I couldn't even really understand on the phone. That's how rapid. But I could understand enough that she understood that I was coming there, that was saying it was okay to come. And when I was there in person, I could understand a little bit more um, of what she was saying, but it was such a decline. It wasn't even a year, it was just so, and it was a very much of a decline from when I had talked to her in the March. And she did in that conversation say, well, they didn't know if it was MS or ALS. Some of her symptoms were very similar when you were like even showing on the diagram. And I said, well, yeah, they don't, neither sounds real good, but she was saying, I'm glad I have this instead. And I was like, why? Why are you glad? She goes, because it's not gonna drag on. Like it's gonna, she was just like, it'll be quicker and uh and then you fast forward just by October, all of a sudden, my cousin was having to move her to a different state to be by her, and then by and that all got planned out in that November. And my daughter and I visited, and she was getting moved. Well, first it was moved to assisted living from October to November, but it didn't last. And then she moved, and then she died like on New Year's Eve, New Year's Day. I mean, so it wasn't even just a real year. So just looking at that, and how different people, how you're suffering, but again, discussing those values and where she was like, I am if I have to do this, I'm glad that it's going to be quick, and just having the autonomy to be able to make some of those decisions. And I think people's faith, again, your faith and your supports from whatever faith that you have is very, very important. And again, with that spiritual, as we're aging, our spirituality and whatever that means towards us, which that will all, some of these things I think are going to be talked about on Thursday with in terms of hospice and what our needs are and but the ethical considerations come in because a lot of times the people caring for us or that person doesn't feel necessarily the same way. And so there becomes a conflict sometimes. And so we really have to take into regards what they're consider the person, but what the person's values are versus what our own are. And again, that comes in with the planning and if we have the right documents and things. So what
Because
the
people only know if you tell them,
mhm, yeah.
So
Go.
building your support team, and I know we've sort of hit on this throughout this presentation, but a lot of times when when somebody has a baby, they say it takes a village, right? I think it absolutely takes a village when we're talking about end of life care considerations as well. between doctors and care managers, attorneys, clergy, family. I mean, you name it, family, friends, neighbors, you need a community, you need a group of individuals behind you to support you. And even if you're an individual who doesn't maybe have a large family, that's okay. You just need to know that there are community resources out there, there are professional resources out there. There are all kinds of people who are very much equipped to help, and want to help. You just have to know to ask, and don't be afraid to ask for that support. Don't be ashamed. Don't be embarrassed. Whatever it is, people are out there who will support you, and you need that support. It will be everything is much easier if you accept that you cannot and should not do it alone. Face any of these illnesses we've talked about, any we haven't talked about. And we mentioned, it's not our next presentation, but the one after that, we're going to be talking about all the community resources that are available. And so I think that'll be a super helpful conversation, just for people to be able to know that these are some resources in the community, that are available to me or to my loved one. So yeah. Key takeaways here. Early and honest planning brings peace of mind. It brings peace of mind for you. It brings peace of mind for your loved ones. Make sure to get your documents in place while capacity allows. It really significantly curtails your choices, your loved ones' choices, and what will happen if you don't get those documents in place. So it was our second talk that was 5 absolutely essential legal documents. I encourage you, if you haven't watched it, go back and watch that. Make sure you have those in place. I mean, before the time of diagnosis would be ideal, but then if there is a diagnosis of something we've talked about, of a dementia or of one of these more debilitating diseases that comes up, okay, well, now's the time, and it's really a wake up call to not push it off anymore. Support caregivers and family through community resources. So I didn't really touch on that, but not only are there community resources for the individual with the illness, but there are also community resources for the loved ones. So for, whether it's your mom who's experiencing the dementia, or maybe it's your neighbor that you've been bringing food to, twice a week for the last 6 months, whatever it is, there are community resources out there to help you with those caregiving functions.
And I think that's an important thing with, Aging and Advantage being a provider for the St. Louis Area Agency on Aging, and there's other providers, and we all have different resources that we can bring in, but bringing in a care manager to help you figure that out, and if possible, but also just knowing that, getting to that point where, well, I don't know all the resources and I need to reach out and find them to best be able to support my family, but also myself, because I can't do everything.
Yeah, absolutely. And compassionate planning honors dignity and independence. Super important, none of us, not your loved ones, not any of the professionals in this field, we all want to respect your decisions, your independence, your autonomy, and follow those things. But if we don't know, then we are limited in our ability to help you. And we'll do what we think is best. But like Gail was saying earlier, that doesn't necessarily mean it's what you would have wanted or what you would have thought was best. So really having those conversations as early as possible is the best way to go. And yes, maybe then the plan does change down the road as we get a little further, and as diseases progress and as your needs might progress. But we can talk about that too, okay, what happens if we get to the point where you couldn't stay at home? Maybe you want to visit a few facilities and see what you would want. Not that you're going there right now, or not, maybe you will never have to, but if we do get to that point, maybe it's a good idea for you to take a look around and see, what kind of facility or what facility you might like. It's just, the more pragmatic we can be about these situations, the better off we are, and the better off everyone is.
And I
Uh,
think, a key to that is if I'm thinking about it with our theme of being a roadmap, we're following the map, but many times we can have our route planned out. How many times that we're in our car and we're on this trip and then there's like an accident in front of us that's blocking the way. We have to change. Or if you turn the wrong way with your GPS, it's saying, oh, rerouting, rerouting, rerouting. We got to be paying attention to when we do need to reroute, when that's going to help us and save us, time, energy, and what have you. I'm just visually thinking of that when you were talking.
well, that's absolutely right. I like that. Um, yeah, I like that a lot. Okay. Reflection and action. Gail and I just included this slide, because these are just some helpful prompts maybe for yourself or maybe for a loved one. If you have somebody in mind that you're thinking, oh, me and my mom have never really talked about any of this. These are just some helpful little prompts for you to start thinking about some of these things. So for yourself, you can ask, what's one action I can take this month to prepare for changing health needs? What family conversations do I need to start or do I need to revisit? What resources or professionals can I reach out to for help? It never hurts to just have a few ideas in the back of your mind, because a lot of the illnesses today, they do give us the benefit of some sort of time, from diagnosis to start planning. But in other situations, I mean, we had a client whose wife had an aneurysm one night. And now she has a trach and she has a feeding tube, um and so they never really, I mean, it happened at like 3 o'clock in the morning one day, and they never had the opportunity to have these conversations. Sometimes there's not that warning, there's not that diagnosis, there's no time um that is sort of transitioning you from being perfectly well to someone who is needing a lot of care. um So having these conversations earlier never hurts. Um, Ask a loved one, maybe, have you thought about preparing for changing health needs? What kind of care would you want? What family conversations do we need to start or revisit? And do you have your essential legal documents in place? Please, please, please. It never hurts to ask. And I guarantee you it will make your life easier if your loved one does have these documents in place. Even if it's not you who is designated as the agent, just to know that they have someone is extremely important. Preparing your legacy is an act of love, not just for the future, but for peace of mind today. And like we talked about before, it's peace of mind, for yourself, it's peace of mind for the ones you care the most about. So,
I really, really like that thing. Like
yeah.
we're just not thinking of it sometimes. And well, why do I need to do it? And really, it's benefiting because I have heard people say, "Well, I'm not going to be here. What do I care?" And you'll let them fight it out or what have you. But it's kind of one of our last acts of love, to help them get through and eventually, no matter what, they're not going to have some peace of mind. They're going to be upset, but eventually those memories and that peace that was offered at that time is going to get them through.
I think so too. And so many people, focus so much on, this is how much I'm leaving to my kids, or I'm leaving the house to this child or that child. And those aspects of estate planning are very important and very important to a lot of people. But I think sometimes people are so hesitant to look at, what does life look like, you know? Um, and what can I do for my kids when I'm still alive to ensure that sort of that transition process is as easy as it can be. I like that too, Gail. And it's an act of love. Yeah. Okay, what's next? Our next presentation is going to be this Thursday, October 30th. It's at 10:30, and it will be on hospice and end of life. So Gail's daughter actually is going to talk for us. For most of this presentation. It should be really good. I'm excited about it. If you have any questions, feel free to email either me or Gail. You can also call, and there's our website at the bottom. And this is just an overview. It shows all of the webinars we've done in this series. If you want to go back maybe and watch one, you would be able to find it. This was dementia and special consideration, so we still have 3 more after this: hospice, end of life. We have one seminar on community resources and supports, and then our last one is just going to be sort of an overview, pulling it all together. Why did I watch all of these? How do they fit together? And what does it mean moving forward? So we're excited about it.
Yeah, and they're immediately on Aging Advantage Facebook page, but very shortly after that, they do go onto the YouTube channel, which then you can really find them, not having to scroll down in time. You can find them exactly for the date. But and it was important you altered the times a little bit on these. A few of them we've had to adjust the time a little bit, and so because of things that were happening. So those times are indicated there. And again, on Thursday will be hospice, and Lee is a chaplain and does a lot through the hospital and for hospice and palliative care and all kinds of end of life considerations there, and the spirituality and aging, which we touched on just a tiny bit today. So that should be a good topic for us. But thanks for joining us. And I'm so glad that Amanda can go back and forth on these topics so easily because of just knowing it's all holistic information that needs to be known if we're going to prepare our legacy and get that peace of mind.
It really helps making it more conversational too, I think.
Well, we will see you on Thursday then.